lot of sun coming in my office. It's okay.
We're here today with Jean Olive, Chief Technology Officer of Best Buy Health. Jean, thank you so much for joining us today.
Thank you for having me.
So, Jean, Best Buy Health, there's a lot of brand recognition across the country for Best Buy. Obviously, a new entry into the healthcare space. Why did Best Buy enter the healthcare space? And elaborating on that theme, why are other retailers entering the space?
Well, Best Buy entered that space because Best Buy's purpose is to enrich lives through technology. And so with Best Buy Health, we enrich lives through technology and providing meaningful connections across the continuum of care. So if you think about it, technology is in the home, right? And through the pandemic, we've really ramped up having health in the home. So our purpose at Best Buy Health is to enable care at home for everyone. Why is everybody? I think everybody's racing to get into health because one, it's a $14 trillion market. There's lots of opportunity. And I think it's also an industry right now that needs, we're in a crisis, right? We spend a lot of money on healthcare across the country. However, we still struggle with health inequity. We struggle with enough providers, physicians, nurses in a world after the pandemic that where many of them, is a high level of burnout and a high level of stress.
Is Best Buy Health doing anything to address health equity or provider access? Provider
Sure.
burnout?
Yeah, we have some initiatives going on with health equity. We are investing in some health equity platforms. And really trying to build up diversity and minorities getting into the medical profession. We also have our tech centers that also bring in emerging talent, and they have tech centers that the children can come to learn technology, work in the stores, and then continue across, their careers in technology space. We also, if you think about it, when you can enable care at home, and you can enable wellness at home, aging at home, and care at home across the continuum, there are a lot of areas that you can get those devices paid for. For example, our personal emergency response devices, which hang around their neck, their pendants. They have emergency response for fall detection. They have fall detection, and they also have an emergency response button. In many cases, those are provided by the payers themselves. So the payers cover that device, and it has a higher quality of care that enables our aging to age and stay at home versus going into a care facility.
So you mentioned that device that hangs around the neck. So just in terms of a use case to make this concrete for our listeners, when a customer does fall and presses that button and they're brought to a hospital, is there any interconnectivity between their healthcare profile and the electronic health record with data derived from their wearables and connection to the healthcare delivery systems, EHR?
Not to the healthcare delivery system, not in that device. You can buy it. It can be a commercial device where it's provided by a payer, or you could go into the stores or on the websites and buy that device. So first of all, it has fall detection. So you don't need to press the button to have fall detection, and it's a much higher accuracy. It's not, the Apple Watch has fall detection, but you've literally got to be like almost running, hit a root and fall. So it has fall detection, and also can tell if you're about to get a fall. And what happens is the device then goes into our care centers. So our care center agents then know there is an issue. They can dispatch a call to the home, or they can dispatch a call to their emergency care. Then once the person is either dispatched to the hospital, or there's a discussion, that, I fell down, but I'm fine. I don't need to go to the hospital. We don't put that type of information in their health record. Once they get to the hospital, of course, then that would become in their health record.
Okay, so but Best Buy Health is creating a healthcare profile based on many different wearables and
Right,
devices at home. Is that
right.
how is that information ingested into the EHR when they're presenting at the emergency room?
That's not on our, we're not, that's, for that type of device, we do not have that information. For our care at home, where we have, that's all connected through providers. We work with pretty much the 4 of the big 10 IDNs. We're working with 4 of the big 10 IDNs right now. And that is a device that is connected into the health record, because that device is, it's almost like a prescription device, right? Your provider gives you, prescribes that device for you, and then connects you to, based on what your issue is. So that's real telehealth. So think about it this way. You go into, there's all continuums, right? There's acute care, which is, I've had heart surgery. I have to go home and be managed and monitored for 6 to 8 weeks. Or I have chronic care, that I'm in a chronic care, that I have a serious issue, that I have to be managed all the time, or to the extreme that you have hospital at home. And those variables depends on the amount of care that is provided for you by your providers. By your network and your health insurance network. So if I go in, I have COVID. Instead of being, it's pretty serious, but instead of being, I need to be managed and monitored. So instead of having to go into the hospital and have inpatient, I am given this kit. I go home. This is where Best Buy comes in. Best Buy will come in with our Geek Squad capabilities, our in-home service. We have in-home service capabilities now, which, by the way, that is one of the biggest areas that everybody's struggling, is its scalability. And the scalability is the serviceability, because if you think about it, if you come home and you have a problem connecting your digital scale to the tablet so that you can record your weight every day, you'll call back your doctor's office, and the nurse is going to have to try to triage that. No, that's not their specialty, right? The nurses are the ones that say, that you could call and say, well, my weight's gone up, I'm a little concerned, versus how do I connect the device? So we would come in, set everything up, get everything settled per this prescription. Really, it's like a prescription that the provider pays, that, they need to have blood pressure monitored, that we have a cuff that will monitor your body temperature, that monitors your heart rate. And so all those, the profile is set up based on the patient, and then that is monitored, and dependent on the service that we provide. That information then is part of your device history records, right? So that information will be provided and connected into either the hospital or into one of our chronic care centers.
So if there's a patient with a digital enabled blood pressure cuff, a glucometer, and a scale, that information goes into a Best Buy Health profile, which is interoperable with electronic health records at 4 major integrated delivery networks. Is that true?
Yeah, we have many others, but we have the four of the big 10. Yep.
Okay.
Yep.
So Best Buy Health is creating a health profile, and that's interacting with electronic health records. And do you know, are there challenges with driving the digital connectivity between the health profile and the health records, or how does that data connectivity work?
Well, we're working with Cerner, and we're working with Epic, of course, but for right now, that connectivity is part of our platform, and it's either managed by the IDN themselves. So where they set up the triggers, or it's managed by, we have a clinical care center that is managed by nurses, licensed RNs, who then would say, then you have alerts, right? So you think of it's like a big dashboard, you have 100 patients. I don't know the exact number, but say you have 100 patients. And then, if weight goes up by 2%, you see a red alert.
And the alerts go to both the provider and the patient. Is that true?
Well, the patient has the tablet themselves. The alert would go to the provider if they decide, of course, to the provider. But it also, there is an option to go to our command center, our
Mhm.
command care center, which is our nurses that are employed by Best Buy Health,
Got it.
manage and monitor for the IDN.
Got it.
Or
So,
the IDN can choose to do it themselves, right, with their own nurses.
so pivoting a bit back to the beginning of the conversation, you mentioned that healthcare is a $14 trillion market in the United States. Have there been any unexpected difficulties with entering the healthcare market?
Well, I think there's always difficulties, right? There's the whole, the payer market, right? The coding, how are you going to get paid for it? How it's, the adoption. This is something different, right? If you're an aging single person, you know, there's a choice, right? Are you comfortable enough to manage yourself at home?
Mhm.
Of course, with hospital at home, they do have nurses come in every day. So
Mhm.
those are the challenges. Or there's a choice. So would you rather be in the hospital? There's adoption by physicians, there's adoption by consumers. Um, and I think, we're just like at the infancy. I think there is such a constraint in the system right now, right? The hospitals do not have the beds.
Mhm.
Um, but in it, the other sense is people do want to be home. You eat better, you sleep better, you move more, you with your family. Your family
Mhm.
can get in and visit you anytime they want. We have those constraints in the hospital now. You have your pets. So I
So,
think there's always challenges in something. It's a transformation, right? It's a healthcare
mhm.
transformation. So there's going to be challenges every bit of the way. And
So
there's also challenges in scaling.
you mentioned challenges in driving adoption. And of course, many healthcare delivery systems, many of our listeners are very concerned with patient engagement and how to create a digital front door and drive adoption of new programs.
Yeah.
I'm wondering what's driving adoption of Best Buy Health's programs, devices, wearables. Is best. I know that when I've purchased things as a consumer at Best Buy, I enter my phone number at checkout and I have a Best Buy profile and I'll get coupons in the mail. Are you reaching out to every consumer with a Best Buy phone number registered to see how are you driving adoption and to what extent are you doing outreach to your consumer base?
We're not doing outreach to our consumer base, with the exception of our Lively products. So our Lively, with the exception of everything that we have in wellness, of course, at Best Buy, right? So Best Buy does have, end-to-end everything from the wearables to scales to exercise equipment, and then we have our Lively products, which are products designed for active aging, right? We have flip phones that have a health and safety plan to come with them, so you have an emergency response button on the phone. We have a smart version of that phone, and of course we have the pendants. That's where we've leveraged Best Buy. We've also are working to leverage Best Buy's, best in class supply chain and logistics.
Mhm.
And then, but on the health side, we are not, we're not ready yet. We're still building, and growing. And so you're not going to go into Best Buy and see, like you see, like the Geek Squad. You're not going to
Mhm.
see like Best Buy Health. You won't see that yet. We're not there yet.
So
We're working with providers
to what
on the
extent is
care at home.
Best Buy and Best Buy Health, are they separate corporate entities or are
No,
they?
no, same entity at this time. So it's like a business unit within Best Buy.
So what would you say differentiates Best Buy Health from other large tech and retailers entering this space? For example, Google Health, Amazon, Berkshire Hathaway, Walmart taking on risk.
Yeah.
What differentiates Best Buy Health?
Well, we are focused on care at home. So you
Mhm.
won't see Best Buy, you won't go into Best Buy and be like, CVS Health, where you have a provider in the stores. We're not going in that. We are leveraging technology across the continuum of care, starting with wellness at home, going into aging at home, and then care at home. And that is a differentiator, and that we have it across that continuum, and we have the ability of our products to be from, being well to living well as you age to being cared for when you're not well. We also have the Geek Squad, in that we are building up that capability to be able to service your tech in your home. That's something that nobody has at this time. We have credibility in it. So we have, many agents, thousands of agents who are experienced in going in the home. We're working on a program so they can be certified to go in the home for health. And there's a big interest in that, right? If you think about that, everybody's got somebody in their life, most everybody that, that we're caregivers for, whether it's your parents or your grandparents. And so that's one of our differentiators. Plus we have the supply chain and logistics.
So you're talking about driving adoption and differentiating yourself with providing care at home. I'd like you to elaborate. Tell me a little bit about Best Buy Health's strategy that has driven partnerships with large healthcare delivery systems, particularly as they've begun creating e-commerce platforms that sell some Best Buy products.
Yeah, so we do have, and we have some white label working with IDN so that we sell some of the Best Buy products in the white label space. We also are, like I've said before, partnering with IDNs. I'm not sure exactly what you mean by that question.
So, for example, Parkview Health is a large healthcare delivery system in the Midwest, and they have a partnership with Best Buy Health where they have an e-commerce platform and they sell glucometers and scales. So tell me about the strategy that drove that partnership and what you're looking to achieve, and if the health systems are demanding Best Buy Health service and reaching out to you, or if you're reaching out to large healthcare systems, what's driving those partnerships?
Well, I mean, I think we have the capability to do that. That's a white label service. That's done by our consumer health division. They've been working on that. They're also building out platforms so that they can have e-commerce for devices that we sell, such as the Dexcom glucose monitor, right? And you have to have a prescription for that. So I mean, the demand is there, and we have the capability to do it. It's part of our strategy that, if you think about, there's 3 pillars to our strategy: wellness at home, aging at home, and care at home.
Yeah. All right. So I'm trying to think what sort of unusual challenges you've encountered in the rollout of of Best Buy Health. For example, for instance, have you encountered any challenges with cultural resistance to driving adoption? Have you found any false alarms with the pendants that detect fall, that present fall detection? What sort of challenges do you have in driving adoption and use of these services?
Well, I think one of the biggest challenges is just setting the program up within the hospital space of the IDNs, because they don't have it, right? It's not a plug and play. So you've got the challenges to, getting the devices. How many devices are there? We've got to have all those devices connecting into our platform. So if you think about it, you have your, your base station. We have the tablet. Where the consumer either puts the information in manually, or it's connected through a wireless device. But we've got to have that type of device can be connected to the platform. So that's a challenge. And then on the backside is scaling it within the hospital and having them have the program, and that they're ready for the program, because there's a lot of logistics behind the scenes, right? You've got to connect into their device, their patient records. So it's a lot of work, and that's why we're trying to figure out how do we help our customers, not the consumer, not the patient itself, but how do we help our IDNs get in and go beyond patient one, right? Patient one's the easiest, but then you have to scale. So I think, to me, that's probably a bigger challenge than it is. Sorry, my phone's going crazy. That's the bigger challenge, and probably is it with adoption, because I think adoption will come quickly once people see more of it and hear about it more, and they're talking about it now. And one of our early hospital home patients was he was an elderly gentleman, and he's an advocate, UMass Medical, where UMass Medical just won like the best care hospital home program. And they were leveraging our products from our recent acquisition of Current Health. But his son was a physician. So, you think about it, right? You don't know, but then you call it your son's a physician, and he tells you, Dad, it's going to be good. This is a good thing. It keeps you at home, right? With mom, with your pets, with your food. So I think that's like it's got to get, it'll get a snowball effect, right? But it's just got to get more and more. And that's, really why I came to Best Buy Health too, because my dad was dying of congestive heart disease. And his last 4 months of his life were terrible. In and out of the hospital during COVID. My mom couldn't see him. We couldn't manage his medication. We didn't, the visiting nurses when he was in hospice came 2 days a week. That's not enough, right?
Mhm.
His doctor was never connected to him. The whole time I was like, oh my gosh, technology could have helped him live a better life, and it would have been a lot less stress on my mom, the primary caregiver.
So we're approaching the end of this podcast episode. And by the way, I'd like to thank you, Jean, for sharing that story, that personal story of your father. Our listeners are largely CIOs, CTOs of large healthcare delivery systems. I'd like you to speak to our listeners about why a CIO, why they should consider partnering with Best Buy Health. What material benefits will they realize? You've already mentioned there's going to partner. There would require a material investment in logistics and in connecting the patient records with the patient profile. Why should, if you were to speak to CIOs at large healthcare delivery systems, why should they consider partnering with Best Buy Health?
So we have the capabilities. And we have the systems in place that we can enable higher quality of care for their patients, and also help their doctors and their nurses really provide a better care to their patients as well.
All right. Well, thank you very much for joining us. This has been Jean Olive, Chief Technology Officer of Best Buy Health. So thank you, Jean, for joining us today.
Thank you. Have a nice weekend. Bye-bye.